So, a warm welcome to this module of non-communicable diseases. My name is Abigail Kenuma Oruko. I am a registered nutritionist and dietitian, and I'm also undergoing pedagogy training for technical trainers. Welcome. So today we're going to look at non-communicable diseases, and under that we're going to look at chronic respiratory diseases. These are diseases that affect the lungs and airways. When you talk about airways, think about the trachea, think about bronchus, and talk about nostrils. So these conditions include asthma, we have cystic fibrosis, we have sleep apnea, and chronic obstructive pulmonary disorder. What is asthma? Asthma results from an inflammation and muscle tightening around the airways, making it difficult to breathe. That is why when people have an asthma attack, you will hear them wheezing, they'll cough, they'll have shortness of breath, and then they'll feel some tightness in the chest, and those are the basic symptoms of an asthma attack, or basically asthma. What triggers asthma? Asthma is triggered by cold weather. It's also triggered by dust. It's triggered by smoke, fumes, pollen, fur, feather, strong soaps, and perfume. In addition to that, it's good to note that there are some foods or some allergic reactions that can also trigger asthma. Think about that, and we shall discuss later what those foods are. Now, how you can ask yourself, how can one get asthma? So the risk factors include family history. If there's anyone in the family that has a history of asthma, then it's more likely that if you're a member of that family, you're also going to suffer from asthma. There are other allergic conditions, as I've said before. It may also be a risk factor, because when an allergic reaction happens, it can also lead to muscle tightening of the airways. Another thing is exposure to environmental allergens. That is the same thing I talked about as allergic conditions. Then events in early life, such as low birth weight, prematurity, viral respiratory infections, and exposure to tobacco. So when a baby is young, if a baby is born with low birth weight or is born prematurely, that is before 37 weeks of gestational age, there is a high probability that this child is going to suffer from various conditions, and asthma is one of them. So it is good that when mothers are pregnant or they're expectant, they're supposed to take food from different sources and make sure that their food is balanced, it is adequate, it is safe, so that they can bring up a child, they can give birth to a child who has normal birth weight, and can also go to term gestation. The next disease we're going to talk about is chronic obstructive pulmonary disease. This is a lung disease caused by restricted airflow and breathing problem. In this case, unlike asthma, there is no inflammation, and it's also referred to as chronic bronchitis. Some of the symptoms include difficulty in breathing. There's a chronic cough, which means that this person is coughing for a long period of time. You'll think that they have a flu, but it's not really a flu, because it does not go away after a few days like the flu does. And then this person will also feel tired most of the time. Then complications of chronic obstructive pulmonary disease. This person can have lung infections. It can result to lung cancer. This person can have heart problems, weak muscle, brittle bones, depression, and even anxiety. And it is important to note that this disease is also on the rise in the recent past. And yeah, so we should take care of our health and ensure that we are safe from such conditions. Now, causes chronic obstructive pulmonary disorder. Number one is the destruction of parts of the lungs. An infection can affect parts of the lungs and cause the blockage of the airways. Number two, there can be mucus blocking the airways. Remember, mucus is not only produced in the nose, but it's produced in any epithelial lining in the body. So when there's mucus produced in the airways, and the airways reside in the bronchus, in the trachea, in the nostrils, if mucus is blocking those airways, then this person is going to have a chronic cough. And then we also have inflammation and swelling of the airway lining, which is also a risk factor for, it's actually a cause for chronic obstructive pulmonary disease. Risk factors include tobacco exposure, occupational exposure to dust, fumes and chemicals, indoor pollution. When I talk about indoor pollution, think about people who use charcoal stoves in the house. That can also lead to indoor air pollution. If this person had asthma in childhood, low birth weight and prematurity, this person is also at risk of getting chronic obstructive pulmonary disease. Another disease that is not so common, but it happens, it's called cystic fibrosis. Cystic fibrosis, it's an inherited disorder that causes severe damage to the lungs, digestive system, and other organs. It is caused by gene mutations, and family history is a risk factor. It also affects cells that produce mucus, sweat, and digestive juices. What does it do? It causes the normally thin secretions to be sticky and thick and clogging tubes instead of lubricating them. So when someone has cystic fibrosis, instead of mucus, we said mucus is produced in every epithelial lining in the body. So in case of this mucus lining the lubricating the lining, it is going to thicken and clog those tubes, and it's also going to be a risk factor for the other disease we talked about, chronic obstructive pulmonary disorder. Now, cystic fibrosis has symptoms because we've said it's affecting the respiratory system, it's also affecting the digestive system. So the respiratory symptoms include persistent cough with phlegm, wheezing, exercise intolerance. Someone cannot work out for long periods. There's repeated lung infections. Of course, if the mucus is affected, then the barriers are also affected, which predisposes one to infections. Then the nose is stuffy almost all the time, and that is also a symptom of recurrent sinusitis. Digestive system symptoms include foul smelling, greasy stool, poor weight gain, intestinal blockage, chronic and severe constipations. Now, what are the complications? What are the complications of having chronic obstructive pulmonary disorders? Number one, of course, we're going to have damaged airways because of the blockage. We're going to have chronic infections because the lining is affected, it's exposed. We're going to have a growth in the nose. Someone may end up coughing up blood, and even the respiratory, we can have respiratory failure in such a person. And finally, we're going to talk about sleep apnea. This is a condition that most people have, but they'd rather not accept that they have this condition, or they just don't know that they have it. And I think that most of you have heard about it. So sleep apnea is a sleep disorder in which breathing repeatedly stops and starts. So it's not like you will stop sleeping and then you wake up again. It is not conscious, it's actually subconscious. So the symptoms include loud snoring. Most people do not like to be told that they snore. Then there's gasping for air during sleep. Then someone can wake up with a dry mouth or a morning headache, and these people are usually irritable, very irritable. Why? Because they have insomnia, which is lack of sleep at night, or hypersomnia, which is extreme tiredness and sleepiness during the day. So because this person did not sleep during the night, of course during the day they're going to feel tired, and they're going to feel sleepy, and if they're not going to get this sleep, they're going to be irritable. So those are the basic symptoms of sleep apnea. Now we have two types of sleep apnea. Number one, we have obstructive sleep apnea. This occurs when the throat muscles relax and block the flow of air into the lungs. Obstructive sleep apnea occurs when throat muscles relax and block flow of air into the lungs. These throat muscles we're talking about soft palate, we're talking about the uvula, we're talking about the tonsils. They're supposed to be tight so that there's that airway of the airway passage to the lungs. But in the case of obstructive sleep apnea, these muscles, they'll relax, and when they relax, they come together, thus blocking flow of air into the lungs. Another type we have is central sleep apnea. This occurs when the brain does not send proper signals to the muscles that control breathing. So basically, this is where you will find that someone basically stops. They stop breathing during when they are sleeping. They stop breathing, and then the brain remembers that they are not breathing, and then they have to wake this person up to continue breathing. But it's basically something that happens subconsciously. It does not happen consciously. So you will not, it's not something that you will notice that, oh my god, I was not breathing and then I've woken up to breathe. No, it happens subconsciously. That is where you will wake up tired because you've not had what is called REM sleep, the deep sleep that brings about rest. Risk factors for these different types of sleep apnea. Number one, for obstructive sleep apnea, where the muscles relax, we are talking about excess weight can cause the muscles to relax. We're talking about neck circumference. Okay, we're talking about inherited narrow airway. Someone can just be born with a narrow airway. There's nothing they can do about it. Also, gender, family history, use of alcohol, sedatives, and smoking. Those are basic risk factors for developing obstructive sleep apnea. Complications for sleep apnea. So you'll find that these people are tired during the day. That is called daytime fatigue. They might end up with high blood pressure. They might also end up with type 2 diabetes mellitus, because another time we'll discuss on how sleep contributes to the development, a lack of sleep contributes to the development of type 2 diabetes mellitus. And it can also lead to metabolic syndrome, such as insulin resistance, which is also a cause of type 2 diabetes mellitus. We can have hyperlipidemia. Hyperlipidemia is basically high levels of lipids in the blood, and hypercholesterolemia is high levels of cholesterol in the blood. So in summary, today we have talked about the chronic respiratory disorders. We talked about asthma, which is the major respiratory disorder affecting people worldwide. Then we talked about sleep apnea. We talked about cystic fibrosis, and we also talked about chronic obstructive pulmonary disorders. I hope you find this video helpful. Until next time, bye bye.